And I thought, Tarryn, this is one thing you do know how to do, how to be a human being. How do you wish you were being treated right now in this moment? And can you bring this to the conversation and set the tone? Hello, and welcome to the Business of Happiness podcast. I'm your host, Dr. Tarryn MacCarthy, and today is going to be a great day. I wanted to share with you today a story of what happened to me in the dental practice last week. A moment when I realized the power of opening my own heart. You know, I think going into a medical profession as a woman, going into dentistry as a woman, as a Gen Xer. So at a time, let's see, I graduated from dental school in 2002. So at the time, we were not quite 50-50 men and women yet. And in fact, in my residency program, I was only one of 2 women out of 8 in my orthodontic residency program. And now things have changed significantly in the dental world, and we have a lot more women, which is phenomenal. We're finally catching up to Latin and South American dental schools in that regard, in terms of representation of women and people identifying as female in the profession. But, at the time, I was one of a few women. And then as I became more and more specialized in my specialty, I was one of even fewer women. And then those of you incredible women listening now, or men who love incredible women in business, know that the business world is even thinner in terms of representation of women and those identifying as women. And I think that over time, for myself personally, I hardened some parts of me that I thought were weak. And one of those was hardening my heart. Interestingly, opening our hearts, compassion, love, sharing, giving, caring, nurturing, those very feminine traits are all what drew me to the healthcare professions. And yet over time, I think I came to understand those parts of me as being weak. And I kind of hardened my heart a little bit. And it's so interesting when we look at women who progress into very challenging and competitive specialties in both medicine and dentistry, is that we get this perception of us. And there is this perception that you have to be really tough. You have to be really hard to get as far as you need to get. This kind of balance between stepping up your masculine side. And when I talk about that, I mean more that doing, accomplishing, pushing through, making things happen, that kind of a masculine, if you will, side of us, which, by the way, I was really good at. I was really good at just buckling down and becoming kind of narrow-minded in terms of focus. My focus was on point. And I think that, a lot of times I would tell myself that that was very honorable. But what ended up happening with me over time is I started closing off my heart when I was in that role of dentist, orthodontist, business owner. When I stepped into that place, I would put on my super masculine achievement hat, intellectual, achievement driven, pushing, accomplishing, making it happen hat, and close off my heart a little bit. And what I want to talk about today is the process of opening up our hearts again, allowing ourselves as women and men in this profession to experience that part of ourselves, to allow that part of ourselves to be seen, and not just that, but to allow it to amplify and empower our practice and our happiness. So where can we open up our hearts with compassion and gentleness, that very feminine side of us in both men and women and non-binary people. We all have this feminine side of ourselves. And how can we find comfort and safety to allow that soft underbelly to show and allow her to shine? You know, there's a lot of power, a lot of beauty, a lot of connection, a lot of inner fulfillment when we allow that part of ourselves to be seen. The story I'm sharing with you today is not about another patient. It's not about an experience of opening my heart to a patient, because I think that we do that pretty comfortably, and that's kind of the goal. But what I'm talking about today is opening my heart to another colleague. And in this scenario, a not so nice one. The story goes like this. I was in the practice last week, and from the very beginning of the morning, there was this message on my desk that had come in later in the afternoon the day before, that an older gentleman in our community, a dentist, a referring dentist, wanted to talk to me. It's a gentleman I've not really seen very often. I actually couldn't recall his face. We've not had a lot of personal interactions, but it's a referring dentist of ours, and we've communicated on the phone. And it was clear from the message that there was a little bit of a smackdown waiting for me and wanted to put me in my place about something. This is an interesting topic to bring up because I think we've all experienced this in some way. And maybe you've gone through your entire medical or dental career and never had this experience. And oh my gosh, am I impressed? Am I in awe? Because this seems to happen a lot in the dental community. People who want to just let you know when they think you've done something right or wrong. And as a woman, I feel to experience it from older gentlemen who've been in this profession decades longer than I have. This seems to be a recurring theme. Interestingly, not so much for my husband. He doesn't get this kind of admonition often in his practice. So I'm not sure how men receive this, but from my experience, this is not a new thing. Every couple months, I have somebody who wants to tell me either in my marketing or in my wording or in my treatment planning or in my communication with my patients or my communication with them, where they really want to tell me what I've done right or done wrong. In the past, I think I've really shied behind inexperience. But now, being 20 years in this profession, I can no longer hide behind that any longer. I am not inexperienced. Maybe I've shied behind not knowing everything. And here's what I've learned in this profession is there is no such thing. In business, in dentistry, in being human. Perfectionism is not a thing. We can never be perfect in all ways. So I've given up that illusion. I think I've also given up a lot of control because control is also an illusion. So when this message came across my desk, I faced it very differently from the way I would have in the past. In the past, I think I really would have felt a lot of fear and anxiety and trepidation. In fact, I know that procrastination would have stepped in because I know I wouldn't have wanted to make that phone call and be smacked down again by this gentleman. The story behind it was there was an insinuation that we had referred a patient of his to a prosthodontic practice for a specialty, a specialist for something they had asked us for a referral. And as always, we send our referring dentists a letter. If we do anything like that, we CC them and let them know that our patient has asked for a referral to another specialist and this is where we've recommended, and we just want to give everyone a heads up. This was very uncomfortable for this gentleman, and he needed to talk to me about it. So, as I mentioned in the past, this would have been a source of great anxiety for me. In fact, it might have ruined my day. Not only ruined my day, ruined my night. And if this is ringing true, you know what I mean. Maybe you've been there as well. At first, the old language started to come in of, you don't have time for this today, Tarryn. You need to focus on your patients. You need to give them all your attention. This is an unrealistic thing to do, to call someone just to be yelled at and ruin your day and then ruin your focus with your patients. And while that is true, that I still will hold true to that for as long as I need to, setting clear boundaries for myself, I asked myself the question, well, why is it? Why are you avoiding this phone call? And I thought, you know what, Tarryn? You can have a telephone conversation. That's not so scary. I don't know what he's going to say. I'm really putting my fear first by avoiding this phone call because I really don't know what this conversation is going to be about. There's an insinuation from the message. There is a feeling that my receptionist had from her interaction with his receptionist. So everyone's got rumors and expectations of what's about to go down. But the truth is, I don't know. And the other truth is, I can have a phone call. I also know that I can self-regulate. I also know that I'm an experienced orthodontist, an experienced business owner. I also know that I don't make any decisions without thinking them through, without putting my values first, and that I never have an intention to rob someone of their patient-doctor relationship or to take somebody from someone else's office. So I knew that my values were in the right place. I knew my ethics were in the right place. And I knew that I could handle a phone call. And so I did. I called him. And, of course, the first thing that happened was a little bit of anger at the beginning. He buffed himself up and made himself sound very important and angry and stern. And this is where I decided to open up my heart. And I thought, Tarryn, this is one thing you do know how to do, how to be a human being. How do you wish you were being treated right now in this moment? And can you bring this to the conversation and set the tone? How can I open up my heart instead of closing it in this moment to fear and anxiety and assumption? How can I open up my heart? A very vulnerable place, a very scary place. I hear you, I know. But how can I use it to my strength? And so as I did in this conversation, I took a deep breath in, and you know that's my go-to. And I just imagined my heart opening up to this gentleman, another human being. Somebody who has his own story, his own narrative going on. I don't know what's going on in his life. I don't know why he has the need to be angry or set someone straight. I don't know what it is in his life and in his history that is giving him the need to be aggressive. If you're listening to this podcast, chances are you didn't get into business to be miserable. The problem is that people feel that if their business gets busier, if they start becoming more successful, that happiness will eventually set in. But it can actually get worse. This is why I created the Business of Happiness Prosperity Coaching. In this one-on-one coaching, we look at how to redefine success on your terms and re-find the joy and the passion in your dream. Visit me at thebizofhappiness.com and become the happiest business owner you know. So I sent out, in my mind's eye, love and compassion to this gentleman. And I just said to him, hello, how are you? I hope you've had a wonderful summer. And today's a gorgeous day. I hope you're getting outside during lunch. And immediately he puffed up again and wanted to remind me of how important he is and said, oh no, much too busy. He's working through lunch today. Another really interesting old narrative that I no longer prescribe to, that I am so important because I am so busy, that my busyness makes me successful. I don't believe that any longer, because what I learned is that my busyness was tearing me down, and that was not a truth. But this gentleman is still living in this place, and I could feel compassion for him. I've been there. I know what it's like. I know what it's like to feel like my worth revolves around my busy schedule. And the busier I am, the more important I am. The busier I am, the more worth and value I hold. I remember what it feels like to feel that way. And I don't ever want to feel that way again. But man, I remember the fear behind that. And I could give him compassion for it. I also remember what it was like not taking lunch breaks. I remember how sad that was, how draining that was, how that really took away from me during the day, and I didn't have as much wonderful Tarryn to give to my patients the afternoon, and I definitely didn't have wonderful Tarryn that night. That refueling in the middle of the day is so critical to each of us when we're giving so much of ourselves, especially in this profession. So, of course, opening my heart to him was easy. I see in you me. I see myself in you. I know what that feels like. And I opened it a little bit more. You know, what then happened in the conversation was a lot of him talking, getting angry, wanting to say words that were giving evidence of why he deserved to feel that angry, but not saying the wrong thing that seemed inappropriate, like taking away the patient's autonomy or agency, right? This is always a tricky place to talk about when we're talking on the phone about referring patients to additional providers and working as a team, and recognizing that none of us own anybody and that patients have the right to choose and to ask questions and to have agency over their own mouths and their own time and their own appointments. Anyway, I could feel this frustration and anger and animosity coming at me, and I just chose not to let it stick to me and to continue to open up my heart to him. In fact, I even thanked him for sharing his feelings with me. Notice I didn't apologize for anything I had done, because I really didn't believe I'd done anything wrong. But I did thank him for letting me know how he felt. And it completely disarmed him. Now, I'm not sure about this gentleman's perspective of the conversation. I don't know how he felt it went. I know he said what he wanted to say. I know he wanted to be angry, and he was angry, and he let me know that on the phone. I didn't let the anger sit on me. I didn't receive the anger, but I did receive a human connection. I did receive and hold space for him to just kind of have his little anger and then say, thank you for sharing your feelings with me. I hear you. I hear you. How would you like us to do going forward? How shall this relationship look going forward? And we had a discussion, and then that was over. And, you know, just by giving myself permission to open up my heart, I felt free. I felt like I stepped into my true, authentic self. And I asked myself, what is different about this conversation from years past? Why would I have taken this conversation and let it stew and mull and be angry? Why would I have let this stick to me? And I think a big part of it is I don't know that I would have had the confidence to allow myself to share that compassionate opening of my heart. And when I did that, although it was vulnerable and it was definitely allowing for room for me to be hurt, right? I needed to be sure that I could protect my own identity and protect my own heart as well. So opening it was making it extremely vulnerable and giving up a big risk to receiving that pain. It was also allowing me to be myself, who I am. I am a compassionate, loving, kind person. I do want to hold space for people. I do believe that we are all good people, inherently so from our very core, that none of us are trying to hurt one another. I believe that it's just our core wounds and our trauma responses that come out sideways, that we don't learn how to self-regulate, how to take care of ourselves and give ourselves the compassion that we're so desperately seeking. And that sometimes when we're feeling that pain, the only way we know how to do it is to put other people down. You know, one of the tools that we don't learn to access, in addition to how to self-regulate and self-nourish and self-nurture and offer ourselves forgiveness and compassion, is allowing ourselves to be compassionate even in the face of somebody who isn't being that way towards us. Wow. Imagine that. Allowing ourselves to feel love and compassion for someone, even when they're not showing that to us. Not for their benefit so much. Believe it or not, I'm not even doing this for his benefit. I'm doing it for mine. I want to feel like a good person. And for me, that was true to who I am. That was true to who I am at my core. And when over time I've hardened my heart, closed off my heart, I've not allowed the love of other people in, because we can't close our hearts off to just some people. Of course, we can set boundaries with people who are hurting us, and we can make sure that we're not allowing that abuse, right? There is, of course, a huge aspect of setting boundaries and being clear about who you will and won't let in. But hardening your heart all day long as a business owner, as a dentist, as a doctor, as a leader, putting on that hat and then deciding that that closes off your heart for the day, I don't believe is a strength. At least for me, it isn't. For me, having compassion is such an important part of my day. And I remembered a time in my life where I felt like a different person, going to work and coming home from work. And I think that was a big part of it. I was a different person. I was stepping into a whole persona that was not me, because it's who I thought I needed to be. I thought I needed to be the strong, feminine, female dentist who stood up for herself. Old Tarryn might have gotten on the phone and said, listen, don't speak to me that way. And then gone home that night and told my husband and told all my other girlfriends and talked about it and talked about it and talked about it. And with every revisiting of the event, felt the pain again and the injustice again. And what I was allowing myself in that moment was just to let it be. I was not going to change him, not in that moment. That was not the venue to make systemic change in our profession. That was just a moment where he needed to feel his feelings, and I allowed it. And then I was able to go on to see my next patient completely free of that toxicity. It's a really interesting stance. It's a really interesting superpower of being able to open your heart, even when you're sitting in a very masculine role. Being able to tuck into that feminine part of yourself, not in terms of nurturing, which is necessary as a practitioner of your patients, but rather in communication skills. Maybe I taught him a little something that day of how human beings relate to one another, of how human beings speak to one another, without admonishing him and telling him he was wrong, but more subtly modeling it for him and letting him know it doesn't impact me and you can feel any way you want to feel, because that is his agency. That is his autonomy. He's allowed to feel the way he wants to feel. I might not understand it. I might not like it, but it is his autonomy to do so. And opening my heart allowed me to see it that way. I have no doubt that listening to this episode, you have very strong opinions, and I welcome them. I would love to open this conversation a little bit more and see how you feel about it. I would love to know perspectives of, coming from someone who really was a very masculine woman who really loves that masculine side of myself to this day, but learning how to step into a more feminine leadership role and allowing both sides of myself to shine. And when it's good for me to open my heart a little bit. And I will say this. That day I felt great. Whether it was right or wrong, whether I was a notch in my cap or not, is up to anyone to decide. But I will tell you how I felt. And with my new definition of success being spending more hours of my day feeling the way I want to feel, that felt like success. That felt like true Tarryn showing up to the conversation, having the courage to show up to the conversation, receiving the conversation, sharing compassion with another human being, and then being able to fully be present for my next patient. Man, that felt like success. It felt huge. It felt huge. Imagine a place where every day, going into practice as a caregiver in dentistry or in medicine, you have the courage and the self-permission to show up as yourself, to welcome all the parts of yourself, to know when each part of yourself that needs to show up can show up, and giving her the grace and courage to do so. Imagine feeling like yourself all day at work, not just on the weekends or occasionally on vacation, but really loving who you are in the moment, every day. Thank you so much for listening to today's episode. This was an interesting one for me that I wanted to just share with you. And as I mentioned, I'm so eager to hear more from you in terms of your receiving this message and your opinion about it. So please let me know what you thought of this. Please leave me a review always. I welcome that on the Business of Happiness podcast. And if this resonated with you, who is a friend who you could share this episode with today? Somebody in the medical or dental fields who needs to hear this, and empower their day with a message of hope, a message of happiness. And remember, when you feel good, that's when we can do good. Bye-bye.